Good afternoon, everyone. Welcome to the CareSouth Carolina Community Live Podcast. I am one of your hosts, Marit Calhoun, and I am the Director of Social and Community Services with my partner in crime.
I'm the other host. I am the director of MATSUD, and I'm Daniel Myers. I'm just happy to be here, happy to be on this podcast today. Glad to see everybody out there in TV land.
Hey, there go Tamara. She, hey, Tamara. All right. So we got some very special guests on the podcast today.
Yes.
And I don't like to talk for people, so what I'm going to do is I'm going to let them go around the proverbial virtual room and let them introduce themselves. Sir?
My name is Richard Moses, and I reside over here in Florence, and I am the Chief Community Relations Officer for SC Thrive, which is one of the partners for CareSouth Carolina. We've enjoyed a long-standing partnership with you guys, so I appreciate you guys inviting me on this podcast today. Thank you.
Sherry?
Sherry?
Hi, I'm Sherry Johnson with Vantage Point Area Agency on Aging. It's a department within CareSouth. I've been with CareSouth a little over 33 years now. So I'm the outreach coordinator and ombudsman, which is advocates for the ones in the nursing home as well as the ones in the community.
Wow.
Thank you for the invitation.
Oh, you're quite welcome. Miss Tamara, how you doing?
I think she's freezing again.
She's freezing again?
Yeah.
Okay. No problem. And?
Okay, Tamara, keep trying. So, hey folks, I'm Ann Lewis. I'm the CEO of CareSouth Carolina. It's been a real privilege to serve. I am in my 41st year now. I've been the CEO. We look a lot different than when we began years and years ago, even whenever Sherry first began with us. So thank you to Marek and thank you to Daniel for having us. This is a wonderful opportunity, and y'all have done such a great job on this podcast.
Well, thank you for affording us the opportunity to do this, Miss Ann, because it closed a lot of gaps that we need to close during this pandemic where we couldn't get out and educate people and get information out there. This has been a good avenue to get that message across to everybody, everything that we need to get across, especially with what we're going to talk about today, the vaccine and receiving the vaccine, So I think everybody up here has, with the exception of Marek, who's going to be getting his in the very near future, has already received the vaccine. I don't know if you got number one or number two. We're going to let y'all discuss that and give us y'all take on how everything went with the process and how you feel now, if you own your second one, how you feel about the entire thing and your future, how your future look now. So let's start from Miss Ann. Let's start from down here. And we go in reverse.
Okay. So if I act a little giddy and a little excited, it's because I am. I got my second dose today over in my right arm. I got my first dose in my left arm, and folks said you should have gotten it in your right arm because that's the arm that you can keep moving around so that you won't be as sore. The first time I got it, I had maybe a day of soreness. It wasn't that bad. They do advise taking some Tylenol after you get it. I checked in every day with my folks at CareSouth to kind of give an update. This is how I'm doing, folks. This is the reality. Now, they say that the second dose might be a little tough. I got my vaccination to begin with over with McLeod. Thank you, McLeod, because they had the initial supplies. It was before CareSouth got our supplies. I can fill you in on where the CareSouth is on vaccinations a little bit later, but so I was very honored and thank goodness that McLeod did reach out to the 1A partners. So if I seem a little giddy, it's because I am so excited to get this second vaccine. I couldn't be there when the doors opened, but I sure wanted to be.
Okay, Miss Sherry.
I got my first vaccine on the 5th, and Time Ann sent out the email with CareSouth, and she was talking about no problems right then. I had thought about it for a long time, mainly because having at the time my 86-year-old mother that I took care of that lived with me, and then having a husband, 58 years, type 1 brittle diabetic, even more so wanted to get it because of the underlying condition. But because of all the people that I come in contact with, maybe not right now because we're home, but so many that I will be coming in contact with, and I felt like I needed to be an example to get the shot, because it's just like a living will. When they ask you if you have a living will, because I encourage them to do a living will, I can't encourage someone to do something if I don't do it myself. So same with the vaccine, it's just the great example, and, everybody talking about it. And so my husband's not one to have any type of flu shots. But when I told him I was going to have the vaccine, he just kind of hesitated, and he said, I don't know. I said, well, I would love for us to live a long time together and see our first grandbaby just being born, be here to watch her grow up now. So now he's excited to get his vaccine. So I'm thankful for that.
Yeah. Good. The most.
I just got mine on Monday. I was very fortunate, and all I can say is that minute that needle went into my arm, my eyes started welling up, because this has been a long 10 months. As I would often find myself here at the house by alone and listening to some music, and I would often just for no reason, and I might lose my man card over this, but that's okay. And I would just burst out crying, because I was looking at it in spite of everything that's going on. Higher power is still in control. So I was just, as soon as that needle went into my arm, all I could do was, with my eyes welling up, all I could do was just look up to the heavens and just say thank you. And even now, I am just so grateful to have received the first dosage, and I can't wait until my second one, which will be the second week in February. And so what I feel as though my charge is to really implore other people who look like me, because that tends to be the segment that is refusing, that has some type of reluctancy in getting this vaccine. So if it's in God's will, I feel as though it's my job to go out there and just like Ms. Johnson said, lead by example. And then I have to get out there and tell others to let's go ahead and take this thing, and let's trust science and the medical professionals, and let's live instead of waiting. Because as my wife often says, when it comes to the 2 V's, with the way this thing is growing so rapidly, you're going to either get one or the other V. You're going to either get the vaccine or you're going to get the virus.
That's it.
So I chose to get the vaccine. So it was no hesitancy, no reluctancy. I did it willingly, and I'm so proud to have been in that number.
That's right. All right. Well, I took my second one this morning. I took my first one on the 6th of January. And this little card right here, to me, this is my ticket to make sure that if I do contract it, that I won't die from it, and also give me opportunity to be here for my grandkids. Now something else might take me, but it won't be Corona. It would not have the satisfaction of taking me out. Right. So, but this morning, whenever, all last night, I was kind of anxious. So I couldn't sleep because I didn't want to miss the time, because I wanted to be one of the first ones in line. And since McLeod said he was doing it at 7, I want to be knocking on the door at 7 or wait for them and helping them carry the supplies in. But I got there at 7:15, and it was nobody ahead of us. So me and my wife was able to go in and go instantly and get that vaccine. And when it went in, I just said, we did it. It's a big accomplishment. Whoever thought that a vaccine would give you that much satisfaction or that much, you just feel just great. Like I did something. It was like the first time I voted. That was the first opportunity where I knew I made a difference. So I knew I made a difference because if somebody was to catch it, they wouldn't catch it from me. Not to mention, I'm still going to continue to wear my PPE, of course, until we reach that level of immunity where they say, okay, you can pull them down and wear them, until I'm going to keep doing what I'm supposed to do. And like Mr. Moses said, it's from my from our class of people or our group of people, ethnicity, where there is doubt in medicine. And so last week on our podcast, we tried to shatter some of those myths about the vaccine and about everything else. And there was a lot of misinformation in our community about the Tuskegee experiment, where they thought it was the vaccine that was the issue. It was not the vaccine that was the issue. Once again, it was the lack of receiving the vaccine. The vaccine saved lives. We were just not afforded the opportunity to get it. And so we have to understand those vaccines work. I can't force anybody. I can't twist anybody's arm. If I could, I would walk around with arms in my hand all day, at least 10 a day, so we can make sure we cover all the vaccines that we got here and make people take them. But we still have to teach vigilance. We still have to teach, compliance, and we have to teach prevention. So we're going to keep marketing. We're going to keep being ambassadors for this. And CareSouth is right there on the front lines, making sure that everybody live long and healthy lives, either through not getting COVID and having better health. So we're right there. Yeah.
Amen.
Absolutely. And I cannot wait to take mine. I'm going to be in there next week, first chance I get. Um, you know, having tested positive, I was under the impression that I had to wait 90 days. But from what I'm reading now, you don't have to wait 90 days. It's pretty much a suggestion or a thought, or it's not required. So I'm going. I'm on the first thing smoking next week. I'm finding me a site and a location. I'm making some phone calls this afternoon.
Yeah.
Because I want to be counted in that number, as they say.
All right.
That's
All right.
it. So, Ms. Ann, you said that there was some information and some news on CareSouth and,
Yeah.
and going on.
Yeah.
Share that with us a little.
So we actually received vaccine. Hallelujah. We have received the Moderna vaccine. And so we started vaccinating people Tuesday of this week. Of course, Monday was a holiday. So we actually started on Tuesday. And our first plan for this week, because there's a lot to giving this vaccine. There's things that you have to do in the state registry called Simon. And then there's things in this very complicated federal registry called VAMS. And there's all kind of documentation. We have reports to give. So we really had to get our ducks in a row, so to speak, and kind of figure out. So we decided that we wanted to start out with just our staff and also community partners, like other healthcare partners that didn't have the vaccine themselves, like EMS people, funeral home staff, things like that. And then the governor opened up, that's called 1A group. The governor opened it up later in the week and actually said that employees in state and government offices could qualify. So through yesterday, we had given out 134 vaccinations. That's just through yesterday. We've got another, I think 50 or 60 that are going to be going on today. And that all, let's see, that was also included the difference between 134 and 207, whatever that math is. I didn't write it down. Is the number of our community partners that got vaccinated. So we've really done a good job, I think, to kind of begin with. We had advertised that starting next week, we opened up appointments for our established patients. But we didn't fill up all of our appointments, honestly. So you're going to see later today on our webpage, if it hadn't already been there, I hadn't been able to check. Our appointments next week are going to be for anybody that is 70 and over. It's going to be a lot more widely available. And I'm anticipating that we'll get a really good response from that. I think we already have. I think some of the locations have already gotten appointments that have been filled pretty quick. But watch that web page, because the other thing that we're thinking about is the demand is so high out there. There's just a ton of people that really, really want to get the vaccine. That is so encouraging. That our problem is that sometimes we have limited staff in some of our smaller locations. And, if a nurse is out or a medical assistant, then wham, we're really cut off. So we're working on a plan to have vaccine clinics widely available in locations, at least one per county, so that we'll be able to have a vaccine team, or maybe 2 or 3 teams, that can hold these clinics and not have to depend on site staff, so that they can keep on with the business of seeing patients. The governor they've been working with LLR, which is the Labor and Licensing Board, and also DHEC. So we've got a lot more staff that have been approved. Dentists have recently been approved to give the vaccine. Of course, pharmacists always could do it, but also certified medical assistants. They've opened that up, and we're going to have a lot more staff that we can bring to bear on this. So I'm excited about that. I'm excited that we'll be able to have these clinics that'll be targeted in each county, and really rock and roll. Our goal is a pretty big one. We want to give out at least 2,000 to 2,400 vaccines a week. Now think about that. That's our goal, 2,000 to 2,400 vaccines a week. And we're going to do everything in our power to get that accomplished. It looks like it's doable. So stay tuned. I'm excited.
I am too. We got a question in the comments. Somebody asked, how many can CareSouth do a day? And will we also available to do them in Marion County? I pretty much don't answer to that, but I want, Ann, would you mind talking about our limits with that?
Yeah. Marion County, I've got bad news. We can't go into Marion County, but MUSC over in Marion County is holding vaccine clinics. And there's an FQHC over there, and I think that they're going to be stepping up in the very near future to be able to provide some vaccines. We can't, but there's not anything that would stop anyone from Marion County to coming over to our locations. Remember what I said originally, and we've given our established patients a chance to register. But now, come next week, anyone can register and get an appointment. Now, the other thing that you asked was, what's the volume? I wish I had a good answer for that. We've only been opening up appointments in the various sites of about 20 per day. But if we change that plan, and instead of doing it per site, if we have a more centralized vaccine clinic per county, then in order to get to our goal of 2,000 vaccines per week, we're going to have 2 and 3 teams working, maybe even more if we can pull it together throughout our service area. And remember, our service area is Dillon, Marlboro, Chesterfield, Darlington, and Lee County. So we've got large sites in each of those counties, and that's probably where it's going to be best and easiest for us to hold these vaccine clinics. Start running through a pretty good volume.
Mhm.
Stay tuned.
And with that information, it's very important for people to understand that if you make an appointment to come and have a vaccine, it's important for you to show up for your vaccine, because once these vials are punctured, they're only good for 6 hours. And so we have a limit. We have, this is a precious commodity. So it's like pouring oil, like pouring gold down a pit, and so it's not going to be any use to anybody. So if you make an appointment, show up for your appointment and come and get your vaccine, because your appointment could have been somebody else's appointment, right? And we don't want anybody to miss this opportunity.
Yeah.
So each vial usually holds about 10 vaccines. And so with those 10 vaccines, if 10 people said they're going to get that appointment, we're hoping to get rid of that whole vial. But if you don't show up at the end of the day, we can't find anybody to replace you, that medicine have to be wasted. And that's nothing. We never want to do that, ever, because it can be in somebody's arm and saving somebody's life. So be considerate of your neighbors or anybody else. So if you make that appointment, please show up and keep your appointment for your vaccine. Please. Very important.
Please. I'm so glad you brought that up, Daniel. We are keeping wait list. So let me back up and say, right now the target is folks that are 70 and older. But I've told all of my staff and everybody, we don't want to waste that vaccine. So if you're coming down to the window on your 6-hour time limit and you looks like something happened and you've got 2 or 3 doses, find somebody, find an arm to put that vaccine in, because it will break our hearts if we have to waste this vaccine. We need to get it out there.
That's right. That's right. That's right.
So I've got some other news too. Is this a good time?
Yes, ma'am.
All right. So, at the very beginning of this pandemic, we worked, and we still do work, with a business and industry that's over in Dillon County, Harbor Freight. Many of y'all know that. They partnered with us very early on around testing and doing things that would help keep their staff safe. They were very, very concerned about it. And I had an opportunity to actually talk with I reckon he was a president or CEO. So I want to give the kudos to them. And he said something that at that time didn't really sink in with me. He said that he was afraid that until people began to experience loss, death, with close friends and family, that the reality of this pandemic would not sink in. That is something that has really weighed heavy on my mind, because like Daniel and Marek and Richard have talked about, there's been an awful lot of misinformation out there. There's been an awful lot of just plain out incorrect things that have gone on. I lost the brother of a really close friend this week. It really did hit me hard. That family is devastated. This man, he wasn't that old, but he was in circles both at his work and in his circle of friends. They really thought this pandemic was a hoax. No masking, no attention to social distancing or anything, and he's died. And that family is just devastated by it. And we've got to get our arms wrapped around this. Vaccination is a very big key to it, but we are very excited. There is a treatment. Many of y'all might have heard about this. It's called the monoclonal antibody treatment. It is an infusion treatment, which means an IV, that is very effective to prevent hospitalizations or prevent the virus from having a worse outcome, more sickness, and even death. Originally, a few months ago, it was a testing type of environment, but now it's rolling out. And FQHCs across the nation have really been targeted and begged practically to be providers for this monoclonal antibody treatment. You know, a lot of hospitals have had it. They've had it for several weeks now, but you know how hospitals, they're paying attention to patients who are insured and have insurance. We'll be able as an FQHC to provide it to anyone according to their ability to pay. And we are getting registered as we speak to be able to provide that monoclonal antibody treatment. Now, we can only do it at our Hartsville office. We have a really good setup there for ID services. And it has to be targeted to high-risk patients initially. You don't want to, number one, the patient has to have been diagnosed with a positive test results, and they have to be considered high risk. Now, I'm certainly not clinical by any means, but high risk means that you may have a disease like HIV/AIDS, hepatitis C, or other comorbidities, as they're called, that would put you in a high risk category. And that would make you a candidate for this infusion. We are not going to limit it just to our existing patients. We're going to limit it to the community at large. Think about this. Think about in the combination of the vaccine and the monoclonal antibody treatment that we can really begin making an impact. I'm real excited about this. I don't have a date of effectiveness, but it's coming.
Exciting.
That's really exciting right there. Yeah. That's big news. That's real big news.
That's big news. It really is. It's literally fresh off the press. We and working with our CMO, our acting interim CMO, Dr. Steve Smith, the head of our infusion services over there in Hartsville, Jennifer Lynch. Everyone is really excited to be able to do this, and we're very encouraged. We think that this has the potential for making a big difference. So stay tuned on this.
So listen, Marek, I feel special because that was hot off the press on this show today. Hot off the press. What? We got the latest news. Book MSN and CNN. We got it right here.
That's right.
That's right. We got it.
Breaking news exclusive. That was breaking news exclusive. Thank you. Thank you for sharing that with us. We do have a couple more questions. I don't know if we can really answer some of these. Because one's a clinical question. It says, my son is an allergy to sulfur. Is it safe for him to get the shot? I don't think none of us on here can really answer that.
Let me find out for you. I get the answer to her in just a few minutes.
Yep.
We can research that. I do know people that, I don't know how old the son is that they were talking about. You know, they don't recommend the vaccine for anyone under 18 right now. That is there. But I've talked to several people that have pretty severe allergies, and they've gotten the vaccine and haven't had any side effects or any problems or consequences. But Daniel's hot on it and researching it for us.
Yes.
The other one, it says CDC recommends 65 and up, and it says they're asking why is South Carolina at 70 and up. Is there any change in that number coming forward?
Well, I can speak to that. I'm actually part of a DHEC vaccine work group that's out of the PD region. And the 65 and older are right now for patients that are hospitalized, that are 65 and older. We're also understanding that the governor is about to release some guidelines, some expansion of the guidelines that would make it available to parents of medically compromised children. So that'll broaden this 1A category a little bit more. I haven't seen anything conclusively other than those that are 65 and older and in the hospital that are talking about that age group yet. So it might be coming.
Right. And there's another comment. Was there potential for a drive-through vaccine in any of our areas?
There is. Um, there really is. We at CareSouth actually have a vaccine task force ourselves, and we actually meet on every Tuesday morning and every Friday morning. And today we had a meeting, and we decided let us get our arms around doing the vaccines in one location per county and see how that flow goes. And we did a good job in doing drive-through testing. So using that model, we're going to be keeping our eye out and seeing whether or not that could work also. So stay tuned once again.
Right. Wow. Thank you. Thank you. This was really some really good information today. I really enjoyed it. Um, as we look to close, what are some parting words or some encouragement you would give to our fellow community members about taking the vaccine? And we'll start and go around the horn, and we'll start with Ann.
Um, I close all of my emails in this past period of time with "Don't wait, vaccinate." Um, I would like to add to that, don't get discouraged. Hang in there with us. And by us, I mean all of the healthcare providers, the hospitals, the F2HCs, hang in there. Uh, Everybody, I think, is going to be working as fast as we possibly can, even Department of Health and the others that are in our state government. I am pretty confident that the real mission is to get vaccines in the arms of everybody that wants it as soon as possible. If you don't want it, talk to someone, get the facts. You've heard from 3 people, 4 of us now, 5 of us. Wait a minute, I'm counting around it. And I understand when folks have some, I don't know, trepidation, but talk to someone and let us do our best to convince you.
Absolutely. Rich Mo.
Correct. If I had to, a parting word, I would tell people to really do your homework. It's a personal choice, but as for me, I chose to take it, me and my house. But do your homework. Trust in the science. Get off your social media and relying on what you see and hear on social media, and just do some independent articles on the pros and the cons. For me, the pros highly outweigh the cons because I'm an asthmatic. I got high blood pressure and probably a countless other things. So, I had to do it. But if I had to say anything, just to do your homework, listen out for as DHEC brings more and more people to the forefront for the vaccine, and just make that choice. Make that choice to live and not be in fear for the rest of your life. Live and not be in fear.
Jerry, any last words?
Yeah, I just want to encourage everyone to go out there and get it. And if you have second reservation, you might want to think about that you're not going to get the attention are the care that you would get if you just had a common cold, because this is our nursing staff, I have family members, immediately family members that are nurses and PAs and nurse practitioners that is dealing with COVID patients every day. And that's what their life is about right now. And so it would give you a second chance and hopefully not end in the hospital, and you wouldn't be as sick by getting the vaccination. And if you have second thoughts, and I hope I can say this, you just really need to pray about it.
Yeah.
Because it's something that if you want to see your children and your family, that you need to listen to the science. You need to read and trust in the Lord.
Yes. Yeah. No, you fine, Sherry. We on here with two pastors, so good.
Right.
One of them not me, but he working on me.
Yeah. Yeah.
What about
I'm
you?
just so happy that I got my second one yesterday. I just feel like it's a load off my chest.
I know, exactly.
Waiting for 65 and over, because with my husband 68, I'm just waiting because he has agreed to get it. So now I'm just waiting.
All right.
Thank you.
Thank you, Sherry. D.
So, well, to answer the question about the sulfur, first of all, there was 2 cases where somebody that had sulfur, that was taking sulfur drugs, and had sulfur allergies, did have a reaction. It wasn't a severe reaction, but it was a reaction nonetheless. But the CDC advised, if you have any allergies, consult your physician, and you and him make a decision based on what your allergies are, whether this vaccine is in your best interest. So we can only give you what they say, CDC. So talk to your physician. You guys make that informed decision together. Y'all make that together. Don't just take my word for it, which leads me to my point, what I would talk to people about. The first thing is this. I always ask my son always come to me with information from his friends and advice that his friends told him. I said, how can somebody who only have as much experience as you in a situation advise you on anything?
Right.
Seek somebody with experience and higher intellect to get advice from. And the second thing is, when it comes to fear is taught. So be aware of your teachers and your teacher's intent. Okay.
Right.
So make an educated decision. Anytime you make a decision about your health, make sure that you're fully educated and know all of your options first before declining anything that could be a life-saving measure. I'm done.
Right. Absolutely. Absolutely. And before I give mine, could there's another question that came in, and we were missing not the answer. Will in-home vaccinations be offered for those who are unable to travel to sites? Have we heard of anything like that?
That's a really good point. That actually got brought up in the DHEC vaccine task force. In the dream and in the vision, yes, we're very, very hopeful that that can be accomplished. Right now, there is a restriction on taking the vaccine out beyond the sites that have been approved. Right now. So there's got to be a few little things that would change, but otherwise, homebound patients and patients that are unable to travel, we see that, we hear it, and we're going to do everything in our power to address that.
Thank you. And just for me, like I said, that being the lone one on the panel that hasn't gotten it, but we'll have it. I promise you. At the end of the week, next week, I will have it. My first dose. That's a promise. That's a promise I'm making to myself, and I'm making to y'all. So I will have it. But I encourage, like everyone here said, I encourage you again to do your own research, research from reputable sites. There's a lot of information out there. I had someone tell me I read 20 articles. Yeah, but 19 of them was probably from these propaganda sites. So get a reputable site, reputable information, talk to your physician, get that guidance, and make your informed decision. The only way we're going to get a handle on this pandemic is we get a grip on proper masking, physical distancing, hand washing, and the vaccine. Until we get to a point that we achieve herd immunity, 70-80% of the population, and we can get back to a normal life, hopefully. That's my dream, that's my hope, that's my wish, that's my prayer. So
Yeah.
I appreciate, me and Daniel appreciate everybody that came on and shared with us. We were supposed to have Tamara Hilton, Tamara Thompson with us today, but she was not able to make it on. She was having some technical difficulty, but she took her vaccine this week as well. So hopefully we can have her back on to share her experience with the vaccine at a later date. Tamara works in our HR department, so thank to her for agreeing to come on. So we'll get back to her at another date. But thank you all for sharing that information and for breaking news here today. We appreciate that. Man, I feel like an anchor on CNN.
That's right.
ESPN.
That's right. More than
We out here breaking news.
yeah.
But thank you and enjoy your weekend. And if anyone have any questions, continue to post them on this podcast, and we'll do our best to get those answers for you guys. And but until then, we'll see you next week with another episode of the podcast. We'll look early to see what it is. It just comes to us throughout the week. We just don't know sometimes.
Right.
Yeah, we
right.
just don't know.
Yeah.
We'll definitely be back next Friday. So
That's right.
thank you again, everyone, and have a great weekend.
That's right.